Okay, fantastic. Well, thank you everybody for coming today. I'm going to make it a full screen. All right, so this is a really, really important topic today. I know you probably seen all the buzz in the media about perimenopause and menopause, and today we're going to discuss why diet and exercise stop working in your 40s, understanding the cardiometabolic shift of perimenopause and what to do about it. All right. Now, I serve mostly high achieving women, and there are really two myths that high achieving women believe. Myth number one, they think that they're not trying hard enough. And myth number two is that they think that, they're not able to lose weight and all of these things because they're just getting older. And neither explanation tells the full story, and I'm going to break it down what is actually happening. And so, why does this matter? So, this conversation is really not a conversation about weight, but it's really about what's happening underneath our health, right? Because, yes, we may want to lose weight, but metabolic health is the goal. And when I say metabolic health, I want you to understand that your body is kind of like a factory, right? So, with a factory, it does the goal of a factory is to be efficient, right? They are taking in raw material and they're storing it and they're processing the raw material, and it really centers on efficiency to be a well-functioning factory. And so our body is the same. Our body, the goal is to become efficient. And so metabolic health is centered on making our bodies more efficient. And then when our body's more efficient, it can let go of weight, right? But when we have impairment of our metabolic health, what is actually happening? There's loss of lean mass. There's increased fat around the organs, which is called visceral fat. There's increased blood pressure, increased cholesterol, increased blood sugar, and increased inflammation. All right. So perimenopause and menopause, it does not just affect your menstrual cycles. It affects your cardiometabolic health because when your blood pressure, when your cholesterol, when your weight is affected, it also can have an effect on the heart. All right. And so, how does it do this? There is increase in salt sensitivity, which increases blood pressure. There's dysfunction with how cholesterol is processed, and that leads to increased total cholesterol, increased LDL cholesterol, increased triglycerides. It affects where you store fat, right? And so, like I stated, there's increased visceral fat, which is fat around the organs. The organs that are predominantly affected are your heart, your liver, and your muscle. And when that happens, that triggers an inflammatory response, and that inflammatory response leads to insulin resistance. And insulin resistance is going to trigger more infl or is going to store more fat, and that fat is going to trigger more inflammation. So you see how much of a vicious cycle that it can become, and it's something that you cannot out discipline your way out of, or sometimes you can't even out lifestyle your way out of. Now, why does blood pressure start changing? So, when it comes to blood pressure, as we age, as we get older, blood pressure is mostly attributed to chronological aging because about 70% of women have hypertension at the age of 60 years old and older, and that is largely due to chronological aging, right? And so there's a difference between chronological aging, like us getting older, versus ovarian aging, which is what is associated with perimenopause and menopause. Okay. And so, why does our blood pressure start to change? Number one, estrogen keeps our vessels relaxed and flexible, primarily by a chemical called nitric oxide. So, when there's a loss of estrogen, there's loss of oxide, and then our blood vessels become more stiff, they become tighter. That leads to increased blood pressure. Also, there's a system in our body, it's called RAS, and it controls how much salt and water that we keep and we let go of. And when there's loss of estrogen, this system starts to ramp up, and then we hold on more salt and water. And then estrogen helps to keep our nervous system calm, right? And so when there's loss of estrogen, that can increase our sympathetic nervous system, right? Our fight or flight nervous system. And that's going to also lead to increased blood pressure. And then estrogen keeps endothelin low, and endothelin is a substance that tells the blood vessels to squeeze tighter. So there's more endothelin release as a result of low estrogen, then our blood vessels become more narrow. Now, over time, these changes can wear and tear on the blood vessels, and that leads to increased blood pressure. But I want you to know that blood pressure, that is primarily due to chronological aging, and there are some factors from ovarian aging that can also lead to blood pressure, but blood pressure is primarily due to chronological aging. Now, in contrary, cholesterol, that is beyond what we would expect with chronological aging, and so it is more so attributed by ovarian aging. Okay, so our cholesterol, when our cholesterol starts to change and our cholesterol starts to increase, that is more attributed by ovarian aging. So that has to do with perimenopause and menopause. So what ha starts to happen here? Things like total cholesterol, your LDL cholesterol, which is your bad cholesterol, apolipoprotein B, which is a particle that sits on top of the LDL cholesterol. Triglycerides, they all can increase. The HDL, which is considered your good cholesterol, starts to decrease. And this HDL cholesterol is known to be cardioprotective, but the cardioprotection, as we go through perimenopause and menopause, that starts to decrease. And there's a shift towards smaller, denser LDL particles. And that is important to know because these smaller, denser LDL particles, these are the particles that get lodged into the arterial wall and cause this plaque buildup. Okay. And so the most dramatic changes occur 1 year before to 1 year after the final menstrual period, not gradually over time. All right. So if anything, in terms of your cardiometabolic health, your cholesterol, the changes in your cholesterol is primarily due to ovarian aging. Now, does it mean that if you give somebody hormonal menopausal therapy that their cholesterol gets better? No, because hormonal menopausal therapy is still not what is considered primary or secondary prevention for heart disease, right? It's still number one, lifestyle modifications, right? Making sure that you're getting aerobic activity, make sure that you're doing strength training, make sure that you are avoiding foods that are high in saturated fats. And then if you have to be on medication, it would be a statin, right? And so, but it's important that, when we're treating women, that we take this into account that there is ovarian aging that could be a play. I'm not saying that's for everybody, right? Because every woman is different. There are different factors that can affect our health. It could be genetics, family history, environment, but still it's important to take into account when you're looking at cholesterol, taking into account not only the woman's age, but where is she in terms of her menopausal history to see if that could be playing a role. Now, why does weight start changing? Now, we spoke about blood pressure being primarily due to chronological aging. We spoke about cholesterol being primarily due to ovarian aging. Now, our weight is a combination of the two. It's a combination of both chronological and ovarian aging. Why is that? Because as we get older, actually, by the time we turn 30, we start to decrease our lean mass, about 3 to 8% loss by every decade of lean mass, right? And so this loss of lean mass is going to decrease our metabolism. And then when our metabolism decreases, we burn less calories, and that is going to lead to weight gain. Now, the contribution from ovarian aging, that is loss of estrogen. Think of estrogen as a traffic controller. In our younger years, estrogen will direct the fat to go to our butt, to our hips, to our thighs. But as estrogen starts to decline, that fat gets defaulted to the abdomen, right? And so can start to develop fat in the abdomen around the organs. This is called visceral fat. This visceral fat is inflammatory. This inflammation leads to insulin resistance. Insulin resistance leads to more fat storage. More fat storage leads to more inflammation. This is a vicious cycle. And so that is why sometimes there are some women who are like, oh, I used to do all the things, I'm doing all the things that I used to do when I was younger, and the weight is not coming off. What is happening? This is why it's a contribution of both chronological and ovarian aging. Now, this is a very simplistic diagram of what I just explained in the preceding slides, but it's essentially chronological aging and ovarian aging, and then in this at the intersection is your cardiometabolic health. And so there are contributions from chronological aging, like we spoke, primarily blood pressure, and then also our weight, and then ovarian aging, which is, primarily our lipid metabolism, and then also visceral fat that develops because of that. And then with a combination of these two, that is what can affect our cardiometabolic health and can, affect our risk to develop heart disease. And so now this is a simplistic diagram, like I stated, because there's just chronological and ovarian aging here. But just note there are other things that can affect our cardiometabolic health. That can be our environment, our genetics, family history, right? So it's like all these other factors that can affect our cardiometabolic health as women age. Now, the questions you should be asking is not how do I lose weight? And this is what really gets to the heart of the matter. Because, yes, certainly lifestyle modifications is the foundation of our cardiometabolic health, right? And when I say cardiometabolic health, it is essentially everything that I explained before in the preceding slides. It is what I spoke about in the factory example, because our body has a great way of being efficient. And when that efficiency starts to become impaired, that could affect our blood vessels, our cholesterol, it can affect our weight, and that all can affect our heart. And um, so the question is not how do I lose weight? These questions really get to the heart of the matter. The questions you should be asking are, am I losing muscle mass? Right? Because that can lead to weight gain. Has my cardiometabolic risk changed? And what affects your cardiometabolic risk? Things like increased blood pressure, things like increased cholesterol, things like increased visceral fat. And so making sure that you're getting your blood pressure checked, making sure it's getting controlled, making sure that your cholesterol is controlled, making sure that you are checking your body composition to see how much visceral fat you have, or if you don't have access to a body composition device, then at least checking your waist circumference, because your waist circumference to hip ratio is a surrogate marker for visceral fat. Okay. Is insulin resistance playing a role? There are different ways that we can measure insulin resistance. One of that is checking your fasting blood sugar, checking your A1C. Looking at the trends over time is really important. One thing that's really important is because is one thing is this is that sometimes our A1C can be reported as normal on the blood test, but the most important thing is to trend it over time. So anything less than 5.7 is percent is normal, right? And so, but if your A1C was 5% and then it's now 5.5%, even though that is normal, there's an increased trend upward. And so I would say there is certainly insulin resistance playing a part. So making sure to see if there's insulin resistance playing a role. Your body composition, like I mentioned, your body composition is specifically looking at your muscle mass, your body fat mass, your visceral fat. It's important. Your visceral fat is an independent predictor of cardiovascular disease. That's why it's really important, and that's why we want to make sure that we bring that down. And most importantly, what's driving these changes, which I explained, what is driving these changes? There's this balance between chronological aging and ovarian aging that is happening as we get older. So this is an example. This is actually a patient of mine who came to me, and she's in her 40s, and she came to me thinking that she needed another diet, and she also had concerns about her blood pressure. But actually, that she didn't eat another diet. She really needed to understand what her health was telling her at this time, because at this time she was on the precipice of perimenopause and her body was changing, like her blood pressure was changing. It was getting more difficult for her to lose weight. And she's a very disciplined person, right? A lot of the patients that come to me, they are high achieving women. They know how to get the job done. And she basically was like, I don't know what else to do. Like, in order for me to get to the weight that I want to be at, I would really have to exert this level of discipline that I really don't have right now. And so, what she needed, she needed a vision of what optimal health looks like for her 30 years from now. I always tell my patients, I'm not treating you for right now. Yes, I'm partially treating for right now, but most importantly, I'm treating you for 30 years from now. And we are trying to work on your health now so that 30 years from now, we place you in a great position so that you can do all the things that you've worked so hard in your life for, right? And so my goal is to get you to 20 to 30 years from now where we're taking steps where you can reap the benefit of all your hard work. What she needed was the reassurance that she just didn't have to discipline herself through this. I was able to help her through the process and help her understand what her body is telling her and the steps that we needed to take that was different from the steps that she was taking on her own. She also needed to surrender to not having to control every single outcome down to her health. When she came to me, she was a little bit frustrated because she said, I can't control this. And, as high achieving women, we like control, okay? We do. And so, just giving her that peace of mind that you don't have to control this. You don't. You have to understand this, and we have to be able to work with your body to get you to a point where you can see yourself 20 to 30 years from now, right? And the other thing was she needed to understand her body with confidence without being consumed by everything that she saw on social media. Because social media can be very, very, very confusing, and everybody's body is different. And so just because something worked for someone doesn't necessarily mean that it will work for you. So it's important that you um, understand what is happening in your own body so that you take the steps necessary for your own body. And then I think most importantly is that she needed to be guided instead of always having to be the guide. She is a go-getter and she's the one who always takes charge and people are always looking up to her. And part of that, was relinquishing of always having to be the guide that she could be guided to in her health journey. So, if your body has changed, your strategy may need to change too. It doesn't mean that you're failing, but it may mean that you're using a strategy designed for a different stage of life. And with that said, um, my practice is in vessel health and wellness. And the reason why I named it in vessel health and wellness, it stands for invest in your vessel. Because when you make an investment, you typically see the reward, over time, right? It's not instantaneous, but you reap the reward over time. And so that is the same um, reasoning and mindset that I brought into my practice because like I stated earlier, for my patients, yes, we're working on your health now, but even more importantly, I'm thinking about you 20, 30 years from now, right? And so it's what do we need to invest? What investment do we have to make now so that you can have a strong and healthy life 20 to 30 years from now? Because, like I stated, there's this intersection between chronological aging and ovarian aging that affects our cardiometabolic health. And it's important that, we take time to really understand what is happening in our body now so that we can reap the reward later. All right. And so during the consultation, we discuss your goals, your barriers, whether Investal Health and Wellness is the right fit for you. You can scan the QR code to make an appointment with me. And this practice really this was from a gap that I saw in traditional medicine, especially when it comes to women. Because I saw that there was just not enough information surrounding women's health, surrounding the cardiometabolic changes that occur. And I wanted to create this practice for women to let them know that there is no time there's no time that's too late, and there's no time like the present. And so the more that we understand what is the changes that are happening in our body, the better that we can protect our cardiometabolic health. All right. And with that said, thank you so much. Thank you so much for spending your Sunday evening with me. You could have been anywhere, but you're here with me. I'm going to stop the share and then I'm going to stop the recording in case anybody has any questions. Any questions?